Good day, folks. Aaron Sale, one of the CASTED faculty, bringing you case number one of Case of the Month. And the theme for these is one case and just one main teaching point. 50-year-old male slips on the ice. You can look at his x-rays. For this, there may be a few subtle findings on this x-ray, but we're going to focus on one. And what we're going to do is look on the lateral view. Now, let's pop up a normal lateral view. On a normal lateral, you should be able to trace out the tibia and then trace out the fibula. So identify these structures. And on the view that we have, do the same thing. Trace out the fibula, trace out the tibia. And what we want you to do is focus specifically on the posterior aspect of the distal tibia. In this case, if you look on the normal side, it looks fine. If you look on the affected side, on the case that we're talking about, there is a little fragment. This little fragment is called a posterior malleolus fracture. That's the posterior aspect of the distal tibia. This is sitting a little bit up. It actually is minimally displaced. It should be lower down. Sometimes it's more subtle. Sometimes it's undisplaced. If you see a posterior mal fracture, most of the time, it's with a lateral mal or a medial mal fracture. That's a bi or a trimalleolar fracture. Sometimes it's in isolation, and sometimes it's actually higher up with a fibular fracture. We'll dig into those during the course itself. But for this case, what we want you to do is if ever you see a posterior mal fracture, it is more worrisome. In this case, it was an operative case. We'll go through these types of cases during the course. What we want you to do, though, one case, one point, look at the posterior aspect of the distal tibia, look for posterior malleolus fractures, scrutinize that lateral x-ray. And if you see a posterior mal fracture, your clinical concern for the case goes way up. Pay attention to these subtle findings. Hope it'll help you on your next shift. These are the courses where this type of case would be dissected in more detail. So if this is of interest to you, look here. We have a number of CASTED courses available, depending on your interest, depending on where you practice. Go to casted.ca for more details. These courses are all ruthlessly clinical. Orthopedics is challenging. We want you to get it straight. We want you to keep it straight. To sign up for the case of the month, you can do it on Instagram, you can do it on X, you can do it on our website, and we'll email you a link to the case of the month. One case, one point. That's our theme. Hope this helps you on your next shift. Hope to see you at a course soon.